Picture this. It's 7 in the morning. Soft light comes through the window. You wake up like any other day, stretch a little, feel that familiar heaviness in your stomach, and head to the bathroom. But today something is different. You sit down, you wait, and nothing happens. You push a little, nothing. You push harder and you feel something deep down, but it won't come out. It's like something is blocked, like there's an invisible wall. Right at the very end, you think, well, maybe not today. You get up and go about your morning, you have breakfast, you have your coffee or tea, but that sensation doesn't go away. There's something there, pressure, discomfort, a feeling of fullness that won't leave. By noon, you try again and you feel the same thing. Something is there, you can feel it, but it won't come out. Now it's not just discomfort. Now you're starting to get worried. Hours pass. By the afternoon, your abdomen feels more bloated. You feel the urge to go to the bathroom, but when you try, the sensation is strange. There's pressure, there's weight, but your body simply can't finish what it started. Like your muscles have forgotten how to do something they've been doing their whole life. By evening, you're genuinely uncomfortable, maybe even a little scared. You push harder, and at some point you feel pain. Not unbearable pain, but pain that makes you stop. Pain that tells you something isn't right. That night you go to bed with that sensation, that pressure, that discomfort that won't let you rest well. And in the darkness, your mind starts asking questions you'd rather not ask. Why can't I go to the bathroom? What's happening in my body? How long can this last? I need to call a doctor. And this is where I want to stop, because if any of what I just described sounds familiar to you, whether it's happening today, this week, or at some recent point, you need to stay and listen to what I'm about to tell you. Because what you're describing has a name. And it's more serious than most people think. What you're experiencing isn't just constipation. Something very specific is happening in your body. Something that doctors rarely explain clearly. Something that affects millions of people over 55 years old, and most of them suffer through it in silence for days, weeks, sometimes months, without knowing what's actually happening. In the next few minutes, I'm going to explain exactly what it is, why it happens, what the danger signs are that you shouldn't ignore, and what you need to do step by step to resolve it safely. But more important than all of that, I'm going to tell you when this stops being just discomfort and becomes a real medical emergency. Stay with me, because this information could save you from tremendous suffering, or something much worse. My name is Dr. Kurlam. I'm a physician with more than 20 years of clinical experience, and I've guided thousands of patients through problems exactly like this. One of the most common problems I see in adult patients, especially after age 55, is this. The body can't evacuate properly, and instead of seeking help, the person waits. They tough it out. They feel embarrassed. They think it's a minor problem or simply don't know who to ask. That's why I'm here. Not to scare you, not to give you a cold clinical speech full of terms nobody understands. I'm here to explain this as what I am. A doctor who spent 2 decades sitting across from real patients with real problems. I believe you deserve a clear, honest explanation without beating around the bush, without talking down to you, without rushing. So come with me. What's actually happening in your body? What you're describing, that sensation of having stool present in your rectum but being unable to expel it, has a clinical name. It's called fecal impaction or rectal fecaloma. But forget the technical term for a moment. Let me explain it in a way you can visualize perfectly. Imagine a garden hose. That hose has water flowing through it all the time. But one day, at the part closest to the outlet, a plug forms. It's not that water isn't getting there. The water is getting there. There's pressure. But the outlet is blocked. That's exactly what's happening in your rectum. The rectum is the last section of your large intestine. It's literally the waiting room before the exit. When everything functions correctly, stool arrives, your rectum detects it, sends a signal to your brain, the correct muscles contract and relax in the correct order, and evacuation happens naturally. But when there's fecal impaction, the stool has gotten trapped. It's hardened, it's lost moisture. Now it forms a solid, compact mass that your body tries to move but can't. And here comes something that surprises many people. When there's severe fecal impaction, sometimes your body starts producing liquid diarrhea that flows around that mass. That leads many people to think, oh, it passed, I have diarrhea, not constipation. But that's a warning sign. That's your body trying to work around the blockage because it can't break through it. And that misunderstanding, that wrong interpretation, causes many people to take even longer to seek help. I want to be very clear about this because it's one of the most dangerous mistakes I see in my practice. Why this happens? This is the question my patients always ask, and it's the right question. Fecal impaction doesn't happen out of nowhere. There are reasons, and when you understand them, everything starts to make sense. The first reason is silent dehydration. Over the years, your thirst mechanism becomes less efficient. The older body doesn't feel thirst with the same intensity it did when you were 30 years old. This means many people over 55 live in a state of mild but constant dehydration without realizing it. And when your body doesn't have enough water, your intestines absorb more moisture from the stool to compensate. The result, stool becomes drier, harder, more difficult to move. Think about it this way. Fresh mud flows. Dry mud cracks and sticks. That's what happens in your intestine. The second reason is loss of muscle strength. With age, muscles throughout your body lose tone, and that includes your pelvic floor muscles, your abdominal muscles, your rectal muscles. Those muscles work in coordination during evacuation. When they lose strength, the process becomes less efficient. You push, but the effort isn't enough. The third reason is medications. This is something many patients don't know about at all. There are very common medications, drugs taken daily by millions of people that have constipation as a side effect. Opioid painkillers, many antidepressants, many certain blood pressure medications, calcium-containing antacids or aluminum antacids, iron supplements. All of these can significantly slow intestinal movement. And nobody warns you about it, or they mention it so casually that you don't take it seriously until you haven't had a bowel movement in 3 days. The fourth reason is immobility. Physical movement stimulates the intestine, walking, moving, getting up. When a person spends many hours sitting or in bed, the intestine slows its activity. Intestinal transit, the movement of stool through the colon, becomes lazy. And here's something important. I want to talk about something few people know. When there's fecal impaction, the symptoms aren't always what you'd expect. The surprising symptoms you might not recognize. Sure, there's difficulty having a bowel movement, but there are other symptoms that completely confuse people because they don't seem connected to your intestines. The first is loss of appetite. A person with fecal impaction often feels they're not hungry. The abdomen is full, distended, and the body interprets that pressure as fullness. The person eats less, weakens, and attributes the lack of appetite to anything but the real cause. The second is mental confusion or disorientation. This is something many caregivers of older people have seen without understanding what causes it. When there's severe fecal retention, the body can absorb toxins from the intestine into the bloodstream, and those toxins can affect brain function. The older person suddenly becomes more confused, more disoriented, mentally slower, and family members think, is this dementia? Is something happening to their brain? It's not the brain, it's the intestine. I've seen this in my practice more times than I can count. An older patient arrives with mental changes. The first thing we rule out is fecal impaction. And in many cases, once we resolve the intestinal problem, the person becomes clear-headed within 24 hours. I want you to take this seriously. If you have an older family member who suddenly seems more confused, more disoriented, without any other obvious explanation, check their bowels. The third unexpected symptom is urinary urgency or difficulty urinating. The full and distended rectum can press on the bladder or urethra, especially in women. This creates urinary urgency, a feeling of a full bladder when it's not actually full, or difficulty urinating normally. And again, the person goes to the doctor with bladder problems when the real problem is in the intestine. Now, I want to ask you something. If you've recognized any of these symptoms in yourself or someone you know, write in the comments where you're watching us from. Write your country or your city. It helps me understand where this community is coming from, and it gives me a lot of strength to keep creating content like this for you. When this becomes a real emergency, so far we've talked about discomfort, about inconvenience, about difficult days, but I need to tell you what happens when this goes untreated, because there's a point when this stops being a minor digestive problem and becomes a real medical emergency. And that point comes faster than people realize. When stool has been trapped in the rectum for a long time, the rectal wall begins to stretch, to distend, like a balloon being inflated too much. Over time, that distension can cause ulcers in the intestinal wall, small internal wounds caused by the constant pressure of that hard mass against delicate tissue. Those ulcers bleed, and when there's rectal bleeding in an older person, we're already at another level of seriousness. But that's not all. In advanced cases, the excessive pressure can cause something called intestinal perforation. The intestinal wall has physical limits for how much it can stretch. When those limits are exceeded, the wall tears. And when that happens, the contents of the intestine, fecal material, bacteria, toxic byproducts of digestion, spill directly into the sterile abdominal cavity. What follows is a rapidly progressing infection called peritonitis, a massive and fulminant abdominal infection that can be fatal in a matter of hours. I'm not telling you this to scare you without reason. I'm telling you because you need to know that this isn't something you can wait out indefinitely. It's not a problem that resolves on its own with patience. There is a breaking point, and that breaking point exists. The good news is that if you've made it this far, you're making the right decision. You're seeking information, and what comes now is precisely what you need to know to act correctly. But first, I want to talk about an error almost everyone makes. When someone hasn't had a bowel movement for days, the first thing they do is push harder. It seems logical, it seems natural, but it's one of the most counterproductive mistakes you can make when there's fecal impaction. Why? Because straining during defecation has real documented consequences. In older people, especially those with any cardiovascular disease, that intense effort can trigger what's called a vasovagal response. Your heart suddenly decelerates, your blood pressure drops, you get dizzy. In extreme cases, you lose consciousness in the bathroom. This happens. It's not rare. And there are people who've suffered serious falls simply because they strained too hard in the bathroom. Additionally, extreme straining can aggravate existing hemorrhoids, can cause painful anal fissures, and in the case of fecal impaction specifically, it doesn't help at all because the mass is so hardened that muscle effort isn't sufficient to move it. So what actually works? The safe step-by-step protocol. Let's go step by step. But first, I want to be clear about one thing. If you've gone more than 3 or 4 days without evacuating, if you have intense abdominal pain, fever, vomiting, or rectal bleeding, the first thing you need to do is go to the emergency room or call your doctor. That's non-negotiable. But if you're in the early stages, if you've gone 1 or 2 days with difficulty and symptoms are manageable, here's a protocol you can apply safely. Step 1, immediate and active hydration. Drink water, not occasional sips. Drink actively and constantly. Water is the first resource for softening hardened stool. 8 glasses minimum throughout the day. If you tolerate warm or hot water, even better. Warm water has a slightly stimulating effect on intestinal peristalsis. If you want to enhance the effect, a glass of warm water with 1 tablespoon of olive oil on an empty stomach can help lubricate intestinal transit. It's an old remedy backed by basic physiology and completely safe for most people. Step 2, correct positioning in the bathroom. Very few people know this. The position we sit in on modern toilets isn't physiologically optimal for evacuation. The natural position for defecation is squatting. To approximate that angle without fully squatting, you can use a small footstool or box under your feet while sitting on the toilet. Elevating your feet 6 to 8 inches creates a more favorable rectal angle and greatly facilitates evacuation, especially when there's difficulty. This simple change has resolved chronic constipation problems in many of my patients. It seems minor. It has enormous impact. Step 3, abdominal massage. Using your fingertips, apply gentle pressure to your abdomen following the direction of your large intestine. Start in the lower right part of your abdomen, go up the right side, cross toward the left, and down the left side. That's the path of your colon. Gently massaging in that direction with slow circular motions can stimulate intestinal movement. Do it calmly with moderate pressure without jerking motions for 5 to 10 minutes. Step 4, osmotic laxative, not stimulant. If the above measures don't produce results, consider using a laxative, but there's an important distinction that very few people know. Stimulant laxatives like bisacodyl make the intestine contract forcefully. If there's severe fecal impaction, that can cause intense cramping without achieving evacuation because the mass can't be moved. What's most appropriate initially is an osmotic laxative like polyethylene glycol or lactulose. These laxatives work by drawing water into the stool, softening it gradually. They're gentler, safer, and more effective for this type of situation. Always consult with your pharmacist or doctor before taking any medication. But if you're looking for general guidance, this is the distinction you should know. Step 5, retention enema. If the situation doesn't improve, the next level is an enema. A warm water enema introduces liquid directly into the rectum, softening the fecal mass from outside and stimulating expulsion. You can get one at the pharmacy without a prescription and can apply it at home following instructions carefully. In more severe cases, manual extraction must be performed by a healthcare professional. It's not something you should improvise at home. If you reach that point, go to a medical center. When you need to see a doctor, right now, I want to speak with you with complete honesty right now. There are people watching this video who haven't had a proper bowel movement in more than 4 or 5 days. There are people who feel abdominal pain that goes beyond simple discomfort. There are people who have slight fever or chills they don't understand, and they're waiting, thinking tomorrow will be better, thinking it's excessive to go to the doctor for this. It's not excessive. A body that can't eliminate its waste is under enormous stress. That stress has consequences, and the longer time passes, the more difficult and more risky it becomes to resolve. I want you to know this. Going to the doctor for this problem isn't an overreaction. You're not weak, you're not exaggerating, you're doing the right thing, you're listening to your body. Doctors see this constantly. It's a legitimate medical problem and it has solutions, but it needs timely attention. If you've gotten this far feeling ashamed that this is happening to you, I want you to hear this carefully. This problem affects approximately 20% of people over 65 years old chronically. 1 in 5. It's more common than diabetes. It's more common than arthritis. And yet it's the problem people talk about least because there's a deep taboo around everything to do with bowels and evacuation. That taboo costs lives. There are people who suffer in silence for weeks out of shame. There are people who don't tell their doctor because they're embarrassed. There are people who downplay the problem in front of family because they don't want to seem older or dependent, and the body keeps suffering in silence. It's not your fault this is happening. Your body is changing the way everyone's body changes, and those changes require new forms of care. That's not weakness. That's biology. What is in your hands is the decision to act, to not ignore it, to ask for help when you need it. That's strength. How to prevent this from happening again. Let's talk about what you can do so this doesn't happen again, or to significantly reduce the risk, because fecal impaction in most cases is preventable. The most important habit is consistent hydration. Don't wait until you're thirsty. With age, your thirst mechanism fails. Create a ritual, a glass of water when you wake up, a glass with each meal, a glass before bed. Don't leave it to chance. Make it automatic. The second habit is daily movement. You don't need to run or do intense exercise. A 20 to 30-minute walk a day significantly stimulates intestinal movement. If mobility is limited, even getting up from your chair regularly, doing small hip or abdominal movements helps. Your intestines respond to movement. Give them movement. The third is fiber, but the right kind. Here's a very common mistake. Many people start taking insoluble fiber in excess. Wheat bran, for example, expecting it to clean out their intestine. But without sufficient hydration, fiber can worsen impaction because it absorbs available water and makes stool more voluminous but equally hard. The key is balancing fiber with hydration. Soluble fiber like that found in oatmeal, legumes, fruits, plus plenty of water. That combination is what works. The fourth is reviewing your medications. If you have chronic constipation and take medications daily, ask your doctor to review whether any of them contribute to the problem. In many cases, there are alternatives or supplements that can offset the side effect. Don't modify your medication on your own, but do ask. You have the right to know what each medication is doing in your body. The fifth is establishing a bathroom ritual. The human body has rhythms. So does your intestine. Try to go to the bathroom at the same time, preferably in the morning when your intestine is naturally more active. Sit, relax, don't rush, don't look at your phone anxiously, give your body time. And if you feel the urge to go at any time of day, don't postpone it. Repeatedly ignoring that urge is one of the most common causes of chronic constipation. Your rectum learns to ignore signals if you ignore them first. Critical warning signs: go to the ER now. Go to the emergency room or call your doctor if you have more than 4 days without evacuation despite trying basic measures. If you have abdominal pain that intensifies or doesn't ease, if you have nausea or vomiting associated with constipation, if there's rectal bleeding, even minimal, if you have fever, even if slight, if there's complete inability to pass gas, if you feel something is stuck with pain when pressing your abdomen, or if there's sudden mental confusion in an older adult without any other apparent cause, each of those symptoms on its own is reason enough to seek professional help. Don't wait for all of them. One is enough. Closing thoughts. I've dedicated more than 20 years of my life to sitting across from people with exactly the problems we've talked about today. And what hurts me most isn't the problem itself. What hurts me most is the time people wait before asking for help, the time they spend suffering in silence, the time they spend feeling embarrassed about something that's completely medical, completely human, completely normal. If anything we've discussed today has touched you, if you've recognized your symptoms or someone you care about symptoms, don't let it pass. Talk to your doctor. Go to the pharmacy. Take action today, not tomorrow. Your body has been taking care of you for decades. It's time for you to take care of it with the same seriousness. And if this video has helped you, if it's given you information you didn't have, if you feel like someone has finally explained something to you clearly and humanely, share it with someone who needs it. With a family member, with a friend, with someone older you care about. Because this information changes lives when it reaches someone who needs it.